to take care of themselves even more. So we're talking day-to-day issues like more exercise, proper diet, enough sleep, and being able to manage the time in which they manage their time either during workplace or even out of workplace in order to achieve or attain what is necessary or expected of them. So in private practice, what I have come across is a lot of patients who get referred and they are said to have been suffering from depression and or anxiety. And in most cases, when you go further into what is going on, you establish that the employers are expecting more with the same number of employees. They're expecting the employees to fulfill more, to reach more goals and targets as expected by the employers. And for this, they then end up being burnt out because they're trying to satisfy what is expected from the employer. I don't know if that for now will set the tone for the discussion we're having this evening. And if anybody else wants to put an input into that.
Yeah, well, thank you very much for your intervention. I don't know if anyone has something to add about what Dr. Hope has just spoke about. I think that we've all been we've all suffered from burnout at one time or another in our lives. I think that in our studies, in our long and difficult studies, maybe in the work area, I think that the burnout is something that's especially lately is very frequent and present in a lot of people. The problem is that when people suffer from burnout, they do not know what that is. Sometimes they think it's just exhaustion, or they're just overworked, or it's just stress from work. They cannot tell the difference. Professor Cesar wants to say something. You can go ahead, Professor.
I think Dr. Lakal has brought up essential aspects of burnout, but I think we also have to note that it's not only the job situation that causes or that may lead or contribute to burnout. Yes, of course, it can stem from your job. And the key issues about the job situation that you feel like you have little or no control over your work. You're just working for the boss who wants you to perform. And I think Dr. Lakal mentioned that that expectation of high performance is a big problem because sometimes you're not able to do so. And also there's lack of recognition and there is no reward for the good work that you do. Nobody says thank you or well done. Thirdly, there is unclear or overlay demand in your job expectations. You're expected to complete so many forms, you're expected to spend so many hours. At the end of the day, nobody says thank you. And another critical point is that your work situation might be unchallenging. It may be boring or monotonous. Now, this is something that we need to discuss with the employer so that you can be happy in the work situation. Finally, in this work situation, you could be working in a chaotic or high pressure environment. That really creates a problem. The other issue that contributes to burnout is our lifestyle, factors. For instance, if you work much without enough time for socializing or sitting, you self-harm mixed with other people, or you don't have time to go to church or to go and watch movies or go to sporting activities and so on, you may find that you don't have a way of letting out stress or relaxing.
This meeting is being recorded.
And also, there's lack of close supporting relationships. If there are no people around you, are we seeing that face in the main screen? If there are people who are are not supportive to you. You are alone dealing with the stress. When you are taking on too many responsibilities without enough help from others. Now, this part is very important because sometimes it's not that there are no people who can help you, but if you are so tense up about what you're doing and you don't want to delegate, you then continue to carry the stress alone. If you're not getting enough sleep, it's important for people to sleep and rest a little bit. Finally, there are our own personality traits that can contribute to burnout. Some people are perfectionists. The tendency to be so perfect, and they repeatedly do things to make them more and more, impressive. But I think that on its own makes you take more and more stress. But also, if you have a pessimistic view of yourself and the world, if you don't believe what you're contributing is important, if you don't believe that what you are doing is helpful, you don't think the world will benefit from what you're doing, that can really burn you out. So, and then also, if there's the need to be in control, you want to be in control all the time, you don't know how to delegate. The so-called high-achieving type A personalities are very much prone to burnout. So just to complete my remarks, I just need to that burnout is a psychological term that refers to long-term exhaustion, as mentioned by Dr. Kalkala, and diminished interest in work. It has been assumed to result from chronic occupational stress. However, there is growing evidence that its etiology is multifactorial in nature, as I pointed out, with a number of factors looking at personal factors, the job situation itself, and your lifestyle. What I just want to bring out here before I stop is that there is still a controversy today whether burnout and depression are on the same spectrum. They're on a continuum. Dr. Lakalakala says in practice, some people may present as though they're depressed. But when you look at it, factors that make them feel hopeless and so on are work-related. So you may find that there are people who have more depression than burnout or more burnout than depression. But you may find that in both women and men, they can complain of or talk about depression and burnout equally, So when you address the underlying depression without looking at things that may be causing burnout, you're not helping the individual. If you address the work situation, which might be primarily contributing to burnout, and you don't deal with the underlying or associated depression, you may not be helping that individual. Let me stop there and I'll come back.
Thank you so much, Professor. This is actually very interesting, and there is something you spoke about, that burnout isn't especially linked to the workplace. It is definitely the case, but since the title of today is burnout in the workplace, I think that we need more webinars to speak about this particular subject, because there is not only burnout, there is also the bore out. There are jobs that are not stimulating enough. Some people can develop mental health conditions just because in their workplace they are not overworked, they are either underworked or not challenged enough intellectually, and this also can be a very big problem for some people. There is Professor Cesar who wanted to who had a question or a remark. You can go ahead, please.
Thank you, Sarah. Well, I want to share with you one work. I'm cardiologist. I'm working in Russian Society of Cardiology. And in last November, there was a published in the Argentine Journal of Cardiology about the burnout in the cardiologists. 750 participants of survey, and of them, 75% were with burnout. And by the test of Maslach burnout inventory, and well, it was a call to action, because the most of them who was with burnout were the younger doctors and the women. So I think it is an important point of view to start to change the work to a better well-being. So I want to share with you this problem, and I want to listen some ideas to be better in the future.
Thank you, Sarah. Maybe we could ask Dr. Aisha to look at families and children briefly.
Sure, of course. Aisha too, if you're you're with us, Aisha too, because Aisha too actually is a psychiatrist specialist in adolescents and children mental health. Aisha too is from Nigeria, and we're really happy she is joining us today to speak about this subject from another perspective we don't look into very much, but it is as much as important. Aisha too, you can, if you're here, you can, yeah.
Yes, I have. Thank you very much. Thank you for having me. I'm sorry I have no video, but that's my picture, and I'm just as pretty as I am in that picture.
Yes, you
Can you
are,
allow me to
definitely.
share slides, please? Can you allow me to share slides? I have
Okay.
some slides. Okay, thank you. Okay, just 1 minute. Okay, so that's me, Prof. Solomon Ratamani, Dr. Hope Kalakala have said so much about burnout. I mean, we as parents, we as adults, we all have days when we're upset, when we're overworked. However, it's important to know that burnout is much more than that. It's a persistent condition. And as much as burnout affects the individuals, it usually has a domino effect on children, adolescents, who are the younger members of the families. Whatever is causing burnout in adults negatively affects this demographic. And it's important to know that they're usually forgotten in all of this because they may not even know what's going on with their parents. They may have the skills to avoid the situations or the language to express whatever they're feeling or to initiate discussion to try to remedy the situation that they find themselves in. Even if they're able to avoid these situations physically, they may not be able to psychologically. When parents or the adults in the home are burnt out, what usually happens is that interactions may be limited to physical aspects at the expense of emotional ones. So the child looks very well, they're well dressed, they have on their correct uniforms, they're in school, but other aspects of the parent-child relationship are quite lacking. And this may manifest in many ways in children. Of course, this list is not exhaustive, but these are some of the more common ones that readily come to mind, whether they're biological or psychosocial. Parents or adults in the home may begin to lash out. Usually there's neglect or aggression, stroke, violent reactions. So you may find bodily injuries because they are not feeding well, they may become malnourished. They also take on depressive and anxiety disorders, and they may begin to cope in unhealthy ways by using substance. They may begin to have problems in school, they regress to a pattern of earlier behavior, they have developed delayed milestones, harmful internet use, and all that thing. So I'll just talk a bit about what we see in our clinic. The ways in which these children come to us. Sometimes we pick it up when we're taking history of the burnt out adults, when we're taking a family history and asking about the children. We then realize that there's something going on at home and we ask to see those children. Or sometimes the parents may actually notice a change in the child's behavior. They may not realize that it's coming from their own problems, but they do notice a change in the child's behavior and they bring them to us. In a few instances, if the schools are mentally aware, if they have a high level of mental awareness, they could refer the child to us. And in true fashion, what we try to do is very simple, and we try to offer psychosocial interventions first of all. So what has proven useful to us is an adapted form of the behavioral family therapy plus relationship enhancement. We've seen very good results with that in our clinic. Of course, if there are other comorbidities, depression, anxiety, if we have to visit the school, if we have to improve their nutrition, we'll do all of that alongside. So this is just to show what BFT is. BFT, like I say, is behavioral family therapy. We aim for 4 to 5 sessions. In the first session, we assess and engage the family as a whole. Sometimes we do it separately. We see the child and then we see other subunits of the family. But all in all, we do an assessment, we engage, and then we do a formulation. Then we go on to do some information sharing. It's usually helpful to talk to parents or the adults about burnout and how it's affecting the whole family unit. Then we try to improve on their communication skills. And this is very simple. We talk to them about expressing positive feelings, making requests, expressing negative feelings, and then we go on to teach them problem-solving techniques. Then we do 1 or 2 booster sessions and then we disengage from the family. Of course, we're always available for them should they need to see us after that. The foundation of BFT, we try not to be judgmental, we try not to put blame on anybody, and we try to harness the strengths of the family and work together as a unit. So that's what we do in my unit, and then we try to enhance the relationship between the parent or the adults and the children, get them to spend lots of time together, get them engaged in activities that will help them bond, teach them about reward systems for children. And we've seen very good results with that in our clinic, as I have said. So that's just a short brief of what we do in my own center regarding burnout when we see it in families. Thank you very much.
Thank you very much, Aisha, too. This is very interesting. So I don't know if anyone has any remarks or questions about Aisha too's intervention.
Maybe Dr. Kalakal can come in. I'd like to comment on how this burnout really translates into family function, societal function, and so on. Dr. Kalakal.
So what in essence happens with individuals presenting with burnout is that how it affects or impacts on them, it's productivity. there is reduced productivity in the workplace because they constantly feel overwhelmed and cannot attain or achieve or complete the task at hand. So what most individuals that I've seen in my practice present with is they constantly want to be off work because they say they cannot keep up. They highlight to the employer that the task at hand and the time that they're expected to complete it within, it's not sustainable. So whenever one tries to bring this up with in the workplace with the employer, we tend to find a lot of resistance whereby the employer believes that the employee should be able to do more because of the position that they're in, and when their expectations, for instance, that the employer or the employee says they want a financial incentive for their work, then they're expected to do more. So we've come through a period recently where a lot of people were laid off in during COVID times. And those who were able to be retained in the workplace, unfortunately, are expected to continue to cover for the spaces that were left for those who were released. Now, even in other workplaces, for instance, in sales environments, so many more people are unemployed, and the employers are expecting for them to attain more sales and attain or achieve more than what is initially or was expected of them. Now, what this leads to, it's the burnout that we're talking about, and this results in recurrent hospital admissions and individuals missing out on work. Now, a lot of them, as I've said, are initially diagnosed as being depressed, but the right way to go about it is to engage with the employer and see how this can be resolved. Okay, thank you.
Thank you, Dr. Kalakama. I just want to indicate that, you know, we all know ourselves, and most people who have been out will have noticed certain changes in themselves. For instance, in the workplace, they might find that they are very impatient. They tend to explode and talk loudly in the presence of patients. They're very unhappy. But then you find that if the burnout is worse, they begin to make more errors in patient management. This is why we need to intervene, because the more burnout you have, depression comes in too, and you are less careful in terms of managing the patient. At home, you find that you begin to quarrel with family without any good reason. You find mistakes at home, and you shout and you tell them that you know, the world is against you. You become paranoid. Now that's really the extremes of burnout combined with depression. Societally, you may find that you withdraw. You don't mix with friends anymore. You don't go out to things that would relieve you of depression. And I think that is critical. So we have to then advise members, people, in terms of what is the best for them, what can they do? And we have to also predict situations where people are most exposed to burnout. I don't know whether someone else wants to take that further, but what I'm trying to say is that there are things about yourself. You've been a good physician, you've been a good psychologist, a good social worker, but suddenly you find that you are not able to do things in the proper way. And people are complaining about you. Some of them will be afraid to complain directly to you, but they'll send someone to talk to you. That's a time when you have to sit back and say, is it true that I'm doing things properly or wrongly? Why is it that people are now worried about me? Why is it that I'm so impatient? I don't enjoy what I'm doing. Then you must seek help at that point. If you can go down with those slides, I just want to show you one or two things. The next slide. Yeah, now this study was done by, just hold on there. It was done, you know, in interviews in America by Medscape, but they showed that most physicians talk equally about burnout. 42% of them talked about that. But then they also colloquially talked about depression. But when you say I'm depressed, I'm not okay, and so on. But of all these people, 3% of them will have severe depression, not needs clinical intervention with psychotherapy, with medication, and so on. Next slide. This just shows you which physicians are most burnt out. At the top there, you find critical care physicians, neurologists, family medicine specialists, obstetrics and gynecology. Interestingly, you find psychiatrists down there at 36%. And this is interesting because most probably they are able to pick the burnout in themselves quite early. But all the specialties will report burnout and depression. Next slide. Which physicians experience both depression and burnout? That is what we just talked about there. And now, interestingly, the gynecologists have gone to the top there. This slide is very important. Are male and female?
Okay, Professor Rataimain, you can go ahead.
Thank you. What really the survey confirmed is that both female and male physicians or health practitioners tend to deal with burnout similarly. The top thing that they tend to do is to exercise, try to eat healthily, and they try to develop relationships with family, friends, and family members, close friends and family members. They also use music. They listen to a lot of music. That's in the next slide. And then they also find that it is very helpful to try and sleep well, improve your sleep. And many of them avoid, socially isolating themselves. But they find that more women tend to eat junk food, but men also, when they're burnt out or depressed, they tend to eat junk food. And as Dr. Aisha mentioned earlier on, there is, use of substances, particularly alcohol, and binge eating. Now, what is very important also to notice here is that burnout does not remain with you only, as you pointed out. It tends to bring out other feelings that were not there before, that you're not aware of, or of experiences that you've had in the past. And this is where your family and colleagues will say to you, it looks like there is something wrong. Why don't you seek help? I think this is very, very, very important, which leads me to understanding that if you are in certain job situations, like if you are a nurse, a medical doctor, you are in the battlefield helping there as a medical practitioner or health practitioner, could be nurse or any other. Any change in your behavior and level of performance, you have to have it assessed and checked. So those are what you call vulnerable occupations. And because to avoid severe forms of expression of burnout, such as post-traumatic stress disorder, or changing the frame of reference that you have of the world, where you think that the world is negative, everybody hates you. You also want to do something to improve. I think Dr. Kalakala talked a lot about stress, anxiety, and also Dr. Aisha. So if you're unable to concentrate and you have a lot of anger, you don't know where it comes from, and you're a hard worker, bright person who's been achieving a lot, and you have physical complaints that you cannot explain, sometimes even having nightmares and sleep disturbances, suspect that you are burnt out, particularly stuff like alcohol and use of overuse of medications such as painkillers and so on. Now, there are issues that can protect you. In order to protect yourself from burnout, you have to do what other normal people do. You must get good social support. You must also have good ethical principles of practice, meaning that you have to know what you're doing properly so that you don't make more errors. So you have to have good knowledge of what you're doing, and you have to attend You have to attend ongoing training to help you. Finally, to develop competence in your strategies and techniques. You have to be aware that you are highly prone to burnout, and you have to take deliberate steps to reduce it. So you improve your skills, you plan and organize your day, and you pay attention to personal health, both mentally and physically. So to deal with burnout, in summary, there are 3 R's that we can talk about. First one is to recognize, watch for the warning signs of burnout. The second one is to reverse, undo the damage by seeking support and managing stress. If you don't do that, you'll continue to have difficulties in the home situation, in society, and in the workplace itself. Third R is resilience. You have to build your own resilience to stress by taking care of your physical and emotional health. So the people who have managed to deal with burnout emphasized exercise, making sure that you have autonomy in your work situation, and enjoying your work, managing expectations, and having a positive outlook in life. And you have to like your patients. You don't have to hate them and explode in front of them. You have to also seek support from your family and your colleagues, or both of them. You have to talk to your employers about their work environment. Don't be afraid to do so. But primarily, you have to balance your home life and your work life. Don't let one take over the other. I think I'll stop there to say that you really have to take care of yourself. You have to, if you're feeling more depressed, I mean, it's only the psychologist or psychiatrist could say, look, there's more depression here. We may need intervention with therapy and so on. So burnout, it's not just within an individual. It flows out into those he or she lives with in the workplace, in society, and in the home situation. Thank you. You must have hope and vision, you have strategy. That is how Mandela survived, you know, being in Robben Island for many, many years.
Thank you so much. Thank you for this very interesting presentation. I actually love, I love how you finished the presentation, Professor. I think this is definitely something very important, especially like you said, for caregivers and different health professionals. I think that one of the most difficult times that health professionals have survived is the pandemic time, when it was, I think we had many losses, and a lot of colleagues have passed away. A lot of colleagues were severely, they were really, they had the virus. It was very difficult. I was one of them. I was one of the doctors who were practicing, and then had the virus, then had to stop for a few weeks. It was very difficult to keep up, but and this really took an important toll on our mental health. Thank you very much, Professor Ratamayan. I don't know if our few other
Dr. Aisha and Dr. Kalakala are back online. Maybe they want to add to what I've said.
Yes, please. Yes, please go ahead. Yes, so there is, I don't know if Aisha too, or Dr. Hope.
Sí, claro, pero te digo, es una pena la mediocridad.
Okay, so yeah.
Kalakala, any concluding remarks on your side?
I think maybe Dr. Lekalakala is tired. I think this is the end of the day of everyone. And I think
No,
that
he's muted. He's
yeah,
muted.
Yeah. So I
He needs to
asked
unmute,
him.
and also Aisha.
So I
Aisha
asked
needs to
them.
unmute.
I asked them to unmute. I think maybe they. Okay, so Aisha too and Dr. Lekalakala, do you have anything to add? Or we can maybe conclude this session before we conclude the session. I see that Louisa is with us. I see other participants. If anyone has any maybe question, we have healthcare professionals here and mental health professionals that can maybe answer your questions. This is once again a very important subject, a very subject that is important to us all as health professionals or other professions. So yeah, I think Professor Solomon, maybe you can conclude this session.
Maybe in conclusion, I could say from my side that the issue of burnout and associated depression and maybe anxiety is a crisis in mental health and general health care, because practitioners tend to make more mistakes. They don't care properly for their patients, even if they are very brilliant, hardworking practitioners. So they have to be taught how to identify burnout, the early signs of burnout in themselves. And secondly, they have to be encouraged to seek help so that they should not continue to work in a manner that is not going to help their patients enough. Let me just stop there. And I see Dr. Lekalakala is unmuted. He may want to conclude his concluding remarks.
Yeah, just what I would like to add is the unfortunate part that we are dealing with currently is, even though we do recognize that burnout exists, a lot of other people, the employers, the colleagues, the family, are not aware. So it's difficult to offer help when somebody is not aware that this exists. Even in healthcare practice, it's difficult for you to put down a diagnosis and say, diagnosis burnout. The patient or the individual should be booked off for a particular amount of time, because it's still not largely recognized as something that needs to be taken care of. So we need to be or come to a point whereby we advocate for recognition that there is burnout and individuals need to be taken care of when they present with the clinical symptoms. Thank you.
Thank you very much. I actually have a question for you, Dr. Lekalakala. Do you, I mean, how, so do you receive in your consultation more men or women who suffer from burnout in the workplace?
In my practice, I've seen a whole lot of female individuals who present with burnout. And when we go deeper into asking or trying to understand why this is the case, you know, a lot of the individuals come from broken households whereby the partners are not involved in taking care or assisting in caring for the children. So women already start from a point whereby they are disadvantaged. Starting off with issues of household care, you know, the cleaning, the making sure that the children are fed, clothed, ready to go to school. So from that perspective alone, they are already coming from a disadvantaged point. And when you then expect them to perform equally with their male counterparts in the workplace, they tend to fare far much poorly, because of everything else that they have to do in the household.
Yeah, yeah. And do you, I mean, what do you advise these women? Because you spoke about a particular issue that is really specific to women in certain context, especially in the African context. I can speak for the women in my country. There is a big, I mean, like you just mentioned, this is actually also a big problem in here, where women take off chores in the household, and since now they work, they also have to tackle work. So this is a big problem. How do you take these women in charge, and what do you advise them in general, just general idea?
Thanks, Sarah. The general advice that I give to the patients that I come across is to seek psychosocial support. We unfortunately, with modernization and moving on with the times, individuals are not involving family members or extended family members. You know, if you ask a simple question to a patient, they will tell you that they've not seen their sister or they've not seen their mother in a month or two. This is becoming quite common because more and more people are moving into urban areas, and there is more and more distance between families.
Yeah.
So in order to receive the necessary psychosocial support, there needs to be an improvement in terms of family bonds and building beyond just family bond, building a support structure around you with regards to having friends around you if your family members are not nearby. So it's a support structure that you need to have to say, can you please look after my kids while I go and complete this other task, or while I go and take care of myself. So psychosocial support, it's important, and that's what I advocate for in these women.
Yeah, yeah, absolutely, absolutely. This is something I can totally get behind. Like, for example, just today I received a patient who is actually suffering from severe burnout, and she is a stay-at-home mom. She's not working, but she's just taking care of the children all by herself. She doesn't have any kind of support, especially from her partner. I think that there is a lot of change that we need to tend to. I think these days women and people in general are under a lot of stress. They need to overachieve. There is this fear of missing out. So people cannot have the same roles like they were assigned before. So we are coming to the end of this webinar. I don't know if any of the participants or any of our speakers would like to add something. If it is not the case, I would like to thank each and every one of you. I would like to apologize for the little technical issue that occurred. I assure you that this won't be happening again. And most of all, I would like to thank Professor Soli for his availability, for being an active AGH member. I would like to thank Aisha too for also being present, for being I mean AGH big ambassador and member, and of course Dr. Hope Lekalakala, who accepted to participate in this webinar on such a short notice. We are grateful, and I would like to thank everyone, and I tell you I'll see you soon, and I'll speak to you soon. Have a great evening.
Thank you very much. Thank you very much, Sarah.
Thank you.